doing his best to help reverse the ravaging effects of cholera on our community. They are not working alone. They are also working in partnership with several other stakeholders. Now, the Zambia Red Cross Society is just but one of them. We have joining us in the studio this morning Mr. Cosmas Sakala. He's Acting Secretary General from the Zambia Red Cross Society. Glad to have you here and welcome to the Breakfast Show.
Thank you so much, Rafa, to hosting me today.
Great. Glad that, of course, you could make it. And, these difficult circumstances, we know what cholera has done. Schools are still on recess, and many hospitalizations, as I just alluded to, are still, happening in our country. Lusaka being, of course, the national center also for the hospitalizations, given that we have the National Heroes Stadium, for instance, hosting the patients. Just help us appreciate, first of all, what you are as the Zambia Red Cross Society.
Thank you, Rafa, for that question, and welcome listeners to this discourse. Very important for our welfare and indeed for our own health security. In the first place, I would like to make mention that Zambia Red Cross Society is a humanitarian aid organization created by government itself to augment public authorities in alleviating suffering of the people during calamities, either man-made or naturally occurring, including epidemics such as the one we're having now, cholera, the COVID-19, and many other health-related events. So we exist based on principles of first of all humanity, of just wanting to assist, to create, to offer a hand to a person or people that cannot come out of their predicament unless external hand comes their way. So we definitely don't do it by ourselves. First of all, government is there with line government ministries that have been mandated to provide the social services to the people. But we do realize that the government alone cannot provide, cannot sufficiently provide those services. This is why we come in and many other actors become handy to ensure that they bridge the gap in the service delivery.
Great. Given that, of course, we are currently faced with the cholera situation, what are you doing? How are you exactly partnering with the government through Ministry of Health to respond to this situation?
Thank you so much. So in the first place, before we talk about the actual response, probably we can get back a bit to look at what were we doing at the preparedness phase. Because cholera is not new in Zambia. We know that the first cases were reported in 1977, long time ago. And until now, we're still battling with cholera. We know very well of which places are prone to cholera, though things are evolving now with cholera breaking out in other countries around Zambia like Zimbabwe and Malawi, Mozambique. Even places that were not traditionally cholera prone areas or hotspots started recording cholera. But the point I'm trying to score is that we are very much aware that cholera is endemic in Zambia, so we are aware that it is likely to break out, and there should be enough preparedness. And we saw the government coming up with a cholera elimination plan, which was, of course, developed through a multi-sectoral approach and mind to ensure that cholera could be eliminated by 2025. So it entailed that there should be a lot of interventions that is are going to change the drivers, the social determinants that are predispose communities to outbreak of cholera. It also entailed that we needed to do so much, including sensitization, well before the outbreak ensues. So we are part of the multi-sectoral mechanism in the country that works with government and public authorities to eliminate cholera in Zambia. So we are part of that plan, including the preparedness activities. So we have been doing some activities many years for preparedness, mostly focusing in at hotspots in Mpulungu, in Nsumbu, which is in Sama district, in Kabwe, Kapiri, in Lusaka itself, so many other activities were done, training our branches in how to help break or interrupt the routes of transmission of cholera. So that was the beginning. But now let's quickly come to the current cholera outbreak vis-a-vis our role in curbing it. So cholera, the current cholera outbreak, of course, broke out in last year, 2023, in October. And since then, we have been part of actors that have joined hands with the government. We've been on the ground deploying our volunteers to go and sensitize the communities. We have been doing door-to-door sensitization of the communities, of the households in these hotspots, more especially in Lusaka, because Lusaka currently is the epicenter, accounting, I think, for more than 90% of the current numbers that are being reported happening in Lusaka. So we've been on the ground supporting what we call the RCCE pillar, which is risk communication and community engagement. But also we've been supporting other pillars such as WASH, which is water hygiene and sanitation, by providing chlorine, household chlorine for domestic water purification. So we've made available the thousands of bottles of chlorine that has been donated through the Minister of Health, and the help with its distribution in the households, in the hotspots of Lusaka. So we have also supported the establishment of the oral rehydration points. These stations that have been created within communities, within the hotspots, to allow for communities to quickly access oral rehydration therapy, so that they can easily be rehydrated should they have signs of cholera. They quickly get rehydrated, and it provides a safe referral to the cholera treatment center, and also sensitization, but also reduce on the fatalities, because people are dying not of the cholera germ itself, but they're dying because of the severe dehydration, which causes a lot of systems to collapse within the body. And finally, we're having so many people who are brought in dead. Right now, the community deaths account for higher proportion as compared to facility deaths, which shows that there should be more that need to be done in terms of sensitizing the communities. So we've been there, and we don't look at one pillar. We look at what areas have serious gaps, so we can support community sensitization and mobilization. We support the case management through community case management, and specifically the oral rehydration points. We're supporting the WASH sector, WASH pillar, through provision of chlorine, so that households can have access to clean and safe water through domestic water purification.
You spoke about the risk communication and community engagement programs that you're engaging in. What would you say has been the response thus far from the communities that you have had a chance to interact with?
Yes, apparently people know the causes of cholera, but normally knowledge alone is not sufficient. But to begin to apply that knowledge is what is critically important. So that gap exists, and we're doing everything possible to ensure that the knowledge transform into a positive behavior that is supportive to preventive and control of the epidemic. This is why we are using a multi-pronged approach to ensure that we can do door-to-door engagement. We can do radio program, just as we're doing right now, television programs that people can watch, and we're doing public address system, working with the other actors such as the Zambia News Agency, ZNBC, so that people get the same messages through the public address. They tune into radio like this one, they hear the same messages. They go to church, they hear the same messages. They tune their television, they hear the same messages. Including if schools were open again, schools would have used that as a platform, so that we're able to educate the learners, and in turn the learners may able to trickle down this information to their households. So whilst the information to some extent is there, but it's the application of the information. You see, when we talk about the messages, is about consume clean and safe water. Can you treat your water? Can you boil your water? Can you cover your food? Can you wash your hands before eating? after visiting the toilet, after changing the diapers of a baby, or after just walking somewhere, after greeting. But you find that even the hand hygiene is everyone knows that just hand hygiene, a simple technique but very important in preventing the spread of disease. But its application, knowledge is one thing, but its application is most important. So this is why we have continued, and we will continue to speak about it, and until everybody is converted by seeing the corresponding behavior being applied.
Mm-hmm. I mean, there's a lot. The cholera situation can be discussed from many angles. Part of which is, I think, what you alluded to earlier, that you, as an organization, have been involved in the preparedness, meetings, for instance, and activities. From where you're sitting today, given that cholera is a known disease, and we are all aware that it is likely to occur or recur around specific periods in a year, what is it that we may have gotten wrong that has put us in this situation? And I'm asking this in the context of the fact that there was a time not too long ago when cholera was almost dealt with. We went for a couple of years without experiencing cholera. Then, of course, suddenly we have it.
Yeah, it is interesting, and that's a very much important question. We should ask ourselves to say, fine, we are told time and again that cholera started in 1977 in Mpulungu, and that the drivers of this cholera epidemics are known. It is consumption of contaminated water. It is poor sanitation, poor hygiene, personal and communal hygiene, and discriminate disposal of waste and the related. We know, and I think we all know that if we touch those areas, would have done away with cholera. I know that in early 19th century, there was cholera in Britain, and they were able to identify what was the cause. And when they dealt with that cause, which was consumption of contaminated water, they just made sure that there's no mix between the sewer and the water that people drink. So it is known that if we are able to provide clean and safe water to our people, we do serious investment. It requires serious investment, both hardware and software. Hardware meaning the actual provision of clean and safe water, piped water, which is treated and all the way remains so until it is consumed in the household. If people are using boreholes and related, to ensure that there's all the safety measures that have been taken. There are regulation to say if you are sinking a borehole, how far should it be away from the pit latrine? How far should it be away from the soak away of this on-site sanitation that we are having today? Many houses, many buildings today have been built and which are not connected to a network of to a sewer network, meaning they are using on-site sanitation, and at the end of the day, these have got a possibility to contaminate the aquifer, and so we know all these that are these are issues. So where we get it wrong is that probably after the short term, after the cholera outbreak like this, when we quench this fire, the question is how well do we insulate the naked lines? Do we get back in the comfort zone and sit? I think we would not win this battle until we look at short, not only short-term, medium, and long-term interventions that should look into investment into wash, hardware wash, how we make available clean and safe water to our people, how we make sure that there's adequate sanitation, adequate and safe sanitation for our people. How do we ensure that people have got the right mindset? For God's sake, it is disgusting to see how people throw litter indiscriminate without any thinking that who will clean that, who will remove that dirty for them. You see, even the elite throwing litter through the Porsche cars, the windows of their Porsche cars. After eating, they just throw it off fly it through their windows. So other than just looking at hardware, whilst hardware can be provided in terms of clean and safe water, what is our mindset? Okay, what is our attitude towards our environment?
So there's need for some kind of cultural remodeling, how we
Serious.
take care of our environment.
Serious.
And I like that you are speaking about this issue, but I couldn't help but also think of the many government ministries that, for instance, we have. Health is just but one. I'm also thinking, as you're talking about the need for people to have good environments to live in. I mean, housing. So then the Ministry of Housing and Infrastructure will come into play. I'm thinking of Ministry of Water. I'm thinking of Ministry of Green Environment, and so it's really supposed to be, I would like to think, a multi-sectoral approach to addressing this issue. And so then long-term solutions are what we must seek going forward. Given that we are already in this situation, we are now basically responding to what has already happened. What would be your suggestion going forward?
So my suggestion, already picking it up from what you've said, that this fight cannot be fought single-handedly. And to put it right, the issue of cholera is not necessarily an issue of the Ministry of Health, because the determinants are totally out of the jurisdiction of the Ministry of Health. When we talk about water and sanitation, it's not the Ministry of Health. So Ministry of Health is coming in because there's ill health, there's a person that is already sick. But the actual long-term, they sit literally outside the Ministry of Health. But because of that linkage, it has to be multi-sectoral. Ministry of Local Government and Local Rural Development, in terms of the town planning. Right today, it is quite challenging even to access certain households. The government is providing water by placing water tanks in strategic places. They are tracking water to fill those tanks. But the access to the furthest house is a challenge. So the tank can only be placed as far as the vehicles can pass. So it simply means other households may need to walk a little bit longer distance to go and access this water. Why? Because the way our unplanned settlement, they build everywhere else. Where there was a road reserve, somebody sees a plot, a 5 by 5 meter plot, 5 meters by 10 meters. It's an adequate plot where you put a house, and there's also a well, there's also a pit latrine within that small area. So that is a challenge, and I've heard that the government is planning to see how they can decongest some of these unplanned settlements and allow for roads, access roads into them, and those people might be given an alternative place where they would go. Hope they will be able to respond positively. But look, talking about the current outbreak, the way forward. We've seen, of course, how the numbers are escalating. We've seen that the numbers of 2023-2024 cholera outbreak have by far surpassed the cholera outbreak we had in 2017-2018, which we thought was the largest cholera outbreak. So that history has been erased. We are talking now of rewriting the history, not in a positive way, but in a negative way. If everybody can come in and come in more positively, we should not look at Heroes Stadium, but we should not look at how to make Heroes Stadium more accommodate more cases, but we should be planning to be closing Heroes Stadium because we have closed the tap in the community. So the issue lies in the communities. Mm-hmm. We go probably in every household to ensure that every person has gotten the right message, to ensure that every person is adherent to these simple but very important techniques, important behaviors that are being promoted through many platforms. If everybody comes in, we want everybody to come in, the civic leader, the really religious leaders, the business people, because everybody else is affected. Mm. So much as it is a health problem, but it is affecting socio-economic affairs of of the country.
Mm-hmm. Let's see if we can draw in participation of our listeners. Perhaps before we have news top of the hour at 8, we can accommodate a call 0770347221. We have Mr. Cosmas Sakala, who is Acting Secretary General from the Zambia Red Cross Society, speaking to us on the Breakfast Show. Good morning.
Good morning, my brother.
Good morning. Thank you very much. Your name and where you are?
This is
I'm afraid we've lost him. You could try again. Do not despair. 0770347221. I think that we're running out of time. I will ask Mr. Sakala basically to, what are the hopes given this scenario? Are we at a point, or will we be at a point where we can put this behind us as a country?
Not all hope is lost. This problem is not insurmountable. I think there are more complex issues than this that we as a country, as a people, as a collection of actors can fail to put out. So we just have to put our money, our investment in the right place with regard to cholera elimination, in the hardware, in continue the sensitization to ensure that we have a total a mindset change, so that people can begin to apply the preventive measures, the control measures, simple as they were, but very important.
And on that note, I would like to thank you very much for making an appearance on this program. Looking forward, of course, to further engagements with you and how basically we are helping to respond to these health challenges.
Thanks so much for hosting us. As Zambia Red Cross Society will remain available, and we work with the government until the last case of cholera.
We appreciate. And that's Mr. Cosmas Sakala, Acting Secretary General, joining us from the Zambia Red Cross Society. Do now stand by for the news coming up at 8.